Hi, everybody. My name is Ramesh Sabapathi. I'm a physician in Ellicott City, Maryland. Um, I'm in Howard County, Maryland, and I've been in this area for 36 years. And my specialty is geriatrics and internal medicine. And I just wanted to give you some of my observations in the last few days of this crisis. Since I gave my first audio report, I'm very happy to say that I've driven through various communities in Ellicott City and I found that most people are complying. I got videos of empty streets, empty gas stations, and very few people and gas station associated food stores. This is a very welcome change because obviously our grassroots message is getting through. And the number of cases in Howard County also has not increased, and our testing capacity is constantly increasing. And I have no doubt in my mind that the flattening of the curve, as Dr. Anthony Fauci talks about mitigation efforts, will start to happen in the next coming weeks. At a personal level, as a care provider for an elderly mother and as a very busy geriatric physician, I could tell you the anxieties and the concerns I go through, and I'm sure a lot of care providers, healthcare providers and care providers for the elderly go through the same anxieties. So over the next few sessions, I would discuss some practical issues. I'm not here to discuss treatment options. I'm not here to discuss number of cases. I'm not here to start a panic among all the viewers. My view is the brighter side of things, how to cope with cabin fever, and how to educate your friends, your colleagues. And from my point of view, my primary aim was to be very supportive to the healthcare workers and my colleagues. Over the last week, I saw that there was a fairly lax attitude in screening regarding our health before we started seeing our patients. And I have written to the various hospital systems. And I'm very proud to say that the long-term care facility I am associated with are much more progressive in their thinking in the area in instituting fairly stringent measures in protecting the healthcare workers. In all these facilities, our temperatures are taken, and in the last 24 to 48 hours, there's a welcome change that they are insisting that we wear a mask and gloves. Just to give you a history, masks and gloves are prohibited in nursing facilities in hallways as per the health department guidelines, as this would start a panic among visitors and so on. And that rule sort of stuck on, so that, and some of the nursing homes were late in adapting to these things, but we have been appealing to the various nursing homes, and it seems that all this is working. And in the hospitals now, screening questions are being asked to most of the nurses as they are coping with this crisis. And today I briefly went to work and went out to every floor in the nursing facilities and gave a lecture and made people who weren't wearing masks to go ahead and wear them for their own protection. So social distancing is good, but I think we are at the point of cutting out all non-essential activities. There is a simple solution to the grocery store visits. Through Instacart or through Amazon or through various grocers, you can have everything you want delivered at your doorstep. So it's okay to sacrifice some of your favorite foods for 2 weeks so that we can recover fast from this catastrophe. And once the caseload starts going down, overall mood will improve, and you will get used to the changes you have instituted in your daily lives. And in my next posting, I will talk about some of the social anxieties, some of the anxieties at home, cabin fever, how it is easy to get deconditioned physically, and that when regular work starts, you're going to find it very difficult to get back to normalcy. So I'm very excited that the compliance has increased in my community. Keep up the good work. Don't worry about chloroquine, oxygen concentrators, and losartan as being a magic cure. Follow the medical experts, and most of you will do well, and all the best to you. And good evening to everybody. And lastly, as a token of respect and appreciation, if you would all tomorrow evening between 7 and 9 have your front porch light on to thank the healthcare workers who go in and day out in spite of all these anxieties. And next time you happen to meet a nurse or a technician or a physician, don't forget to thank them, because they have been there 24/7 during this crisis. Signing off.